Hello, everyone. Welcome back to another amazing episode, 52 Authors, 52 Weeks. Guys, when I say I'm excited about today, and those of you who know me professionally, it will be very clear as to why I'm so excited for my guest author today. But I am here with Dr. Ann M. Hester, who happens to be a physician. And before we get started with this session, she's not your physician. She's not my physician. She's not here to give medical advice. We are here to have a conversation about this book, which I believe it's a movement. And I say that because I've been in healthcare for 32 years, even though I don't look a day over 25.
Oh.
And And I started healthcare as a medical assistant. And as a medical assistant, I was in the room with the physician. So anybody that knows me, I will fight you about a physician. I do not like when physicians are mistreated. I love to empower physicians to improve their documentation, to ensure that, it paints a picture about the patient's care. And so I have a thing about physicians. Anybody that knows me, they know that. So I want you all to meet Dr. Ann Hester, who will tell you a little bit about her background, and then we'll get into the book. And for those of you who have been watching this series, you know we are not going to tell you everything that's in the book because you need your own copy of the book. As I was reading the book, I was doing my usual. I was doing some highlighting and some underlining and made some words like you'll see me talk about this one part of the book that I will explore later. But let's let Dr. Hester give us a introduction.
Well, thank you so much for having me. I'm honored to be here. So I am Ann Hester. I'm a board-certified internist. I practiced for almost 30 years before I pivoted out into more of an administrative role. I am a mom, a wife, a grandmother, a great-grandmother. I'm the dog mama to a 100-pound German Shepherd named Pup Pup. I'm a health coach, syndicated columnist, podcast host, all sorts of things. But I like to think of myself as a physician on a mission to help people thrive, because I've seen so much unnecessary pain and suffering over the decades. It makes zero sense that we accept this as the status quo. And so my mission is to flip it and do as much as I can to empower as many people as possible to optimize their lifespan, optimize their vitality, and just decrease the risk of unnecessary death, disease, and suffering. So that's my story in a nutshell, and I'm sticking to it.
I love it. And I have to tell you, my grandfather today is 103 years old.
That's awesome.
And
great gene.
Yeah, so I am excited about potentially making it to that age one day. But your book, Patient Empowerment, I keep holding it up. You guys know I like to show the cover. Patient Empowerment 101. So let me just tell you, as I do with all books, I start to scan through them. And as I was turning from one page to the next, I was in my zone because I had seen terminology that I have become so familiar with, but then it also helped provide, I don't know, let's just say some confirmation for me that I am empowered as a patient. So I'll just share with you all very briefly, as a result of being exposed to asbestos at one of the hospitals in Chicago, I was diagnosed with reactive airway disease, asthma, right? And so there have been times where I show up at the emergency department, I'm short of breath, and I'm trying to go over my history, what has happened up to that point. And within the last 5 years, when those situations occur, generally time change or when the weather changes, and I found if I keep my weight lower, I can fight that. But nonetheless, I traveled out of the country, had an exacerbation for my asthma, went to the emergency room, and I had my own history written out on a piece of paper, right? 51-year-old African-American female, recently traveled to Ghana, had an exacerbation, started on this, and this, right? And so I had my whole thing, my medications, everything all mapped out on this piece of paper because I was having difficulty breathing and I didn't have time to sit in front of someone in the emergency room to go over my whole little spiel. And so the nurse looks at me and was like, "Are you a physician?" I'm like, "No, I'm just an asthmatic patient that needed to convey to you what had been transpiring with me, what medications I was on, because when I entered that building, I needed some action as opposed to kind of going through the system." And the nurse practitioner on the other end, she told me, "Thank you for bringing in all this information because it did help her navigate my care much more efficiently and faster because I had done all the heavy lifting." So when I saw this book and on the cover, "Expedite your diagnoses, slash your medical bills, think like a doctor, but not you're not going to be a doctor." Okay. Even though I like to tell a little joke, I believe I could do, I'm pretty sure I can do an appendectomy. I'm pretty sure I can make my patient draped in a sterile fashion. I can make my elliptical incision down the midline. I think I could do it. At least I could play one on Chicago Med.
There you go.
But this book is going to help you understand how to have a more educated conversation with your clinician so that the time, and let me just tell you, over the last 30 years, I've seen the amount of time that physicians can spend with patients decrease because the administration is like, "You need to see a new patient every 10 minutes, right?" And you're like trying to work on the computer, but you need to have that face-to-face with the patient. You're missing the psychiatric component, the mental health, and so as a patient coming equipped, empowered is golden, golden. So tell us a little bit about why you drafted this book, which again, did I say I love this book? When I got to history of present illness, I was sitting outside in my gazebo just smiling from ear to ear. If somebody saw me, they would probably say, "What is wrong with her?" I was like, severity and quality. I was like, I know these things in my sleep.
Okay. So I have been passionate about empowering people since medical school. My daddy was a physician. I ultimately went into medicine after, the teeth pulling. I'm like, I don't want to do this. Like, oh, yes, I do. And I started writing my first book when I was a third-year medical student. So when my colleagues were like, "Oh, we have a few hours off for the weekend," and like, "No, I need to start writing," because I saw the amount of unnecessary pain and suffering. And I couldn't wait to have MD behind my name. Like, there's something I can do now. And so over the decades, I have seen so much unnecessary pain, suffering, early death, and so forth. It's just absolutely unbelievable. And another thing I noticed is that doctors think this way, patients think this way, and there's just not this meeting of the mind. One thing that we did, which America's paying for now, is we created this very paternalistic healthcare system. That the doctor would say, "This is what we're going to do, A, B, C, D, and E," and the patient would say yes or no. Often they say, "Sure, doc," they go home and they would do it. Or they just didn't understand, and they don't want to say, "Hey, doc, I don't understand what you said," because they don't want to feel like the doctor doesn't think that they're as smart as they want to come across as being. And so we have been on uneven playing fields throughout. America is trying to do something about that. But just like in the armed services, you know, you have generals, you have captains, you have all of these different people in high levels, and then you have the foot soldiers. The foot soldiers are the ones who are carrying things out. Patients, the population in general, they're the foot soldiers. And so with all of these legislations and all these other things in the works, doing things on this level, individuals, they have so much power, they just don't know that they have the power to turn things around. You gave a perfect example of that. And I also had a lady that I went through these 8 bullet points, eight elements of the HPI, which is a history of present illnesses, that doctors use for decades for billing purposes, and also because when you go through them, it helps you hone in. Probably not what's going on. This is probably not what's going on. This may be. And so as the doctor whittles away at all these things, then the potential diagnoses, I mean, that list is much shorter. I once asked a lady, like over 25 years ago when I was in private practice, I asked her a yes or no question. It took her 10 minutes. I let her keep going because I just wanted to see how long it would take. It took her 10 minutes. Doctors don't have that kind of time. And so what typically happens is when a patient does not know how to communicate well, the doctor's rushing them through, the patient feels offended. I didn't get a chance to finish, or you don't really understand what I'm saying. But the bottom line is doctors are constantly triaging. Okay, I'm seeing you now, but I know Mrs. Jones in the next room, she might be having stroke symptoms. You know, probably not, but I really need to focus on her and get to her. Or there's 10 other people in the waiting room. So constantly the doctor's thinking, how can I help you and get on to the next patient? Because there's such a backlog. And as we look at what specialists, what institutions think will be a potentially catastrophic shortage of physicians, specifically 124,000 physicians short in 10 years, we need to reinvent the wheel. We cannot afford to just go to the doctor, well, get my records from someplace else. Okay, well, you come back in 3 weeks when I have them, so all that time you're suffering, or I'm not really sure what's going on. I think Uncle George was in town and this happened. No, it is very simple to learn how to give the doctor a bulleted list of what he or she needs to know and hit that bullseye. So by the time you finish your last sentence, the doctor should have a very short list of potential diagnoses. They taught us that in medical school, the doctor said that. I'm like, this doctor's a quack. We have MRIs, we have all these things. Surely the diagnosis is not usually in the history, it's in the test, right? Mm-hmm. By the time you finish, if you give an excellent history, your doctor is going to have 1, 2, maybe 3 potential things going on, meaning fewer tests, fewer procedures, less of a need for invasive testing that can be painful, expensive, even dangerous. And so my goal is to equip people with the tools that they need so that when they develop a symptom, I have abdominal pain. Let me think through what's going on. So when I sit and talk to the doctor, I can get to my 1-minute elevator speech so he can quickly diagnose me. And I explained this to a lady I know. A few weeks later, she went to the emergency room. She put it on her phone. And so while she was waiting for the doctor, she went through this mentally. And the doctor came in, she went through the bullet list, and the doctor's like, are you in the medical field? I'm not saying anybody talk to me that way. So basically, he got the diagnosis right, treated her. She went home from the ER. Versus a lot of the time, the doctor doesn't know what's going on. Okay, let me admit you for more tests. Money, 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 money. Medication allergies are wrong. The medications, they interact. I mean, there's so many things that can go wrong. You don't want to be admitted unless you have to. And so my goal and my passion is to empower people so they don't succumb to these crazy things. They don't have to die necessarily. They don't have to spend $30,000 on a diagnosis that really could have taken them $50 to get. And so that is really what this is about, empowering people to optimize their health care, slash their bills, and get a better outcome and be safer with every medical.
I love it. I love it. So This episode is going to air early December. And so I have a message to all of you who are going to be gathering with your family members. You need to start to ask questions about what your family history includes. Now is the time to ask grandmother and them what is long in your family, because it helps you be proactive. So in my phone, the phone is not just for texting and being on social media, the notes portion. I have all of my mother's current conditions, previous conditions, what medication she's on. Then my father was a little different. I had to go old school with him. I have a paper medical record system that's organized by specialty, and he had a stroke. And so when we were he was admitted only for 24 hours, but as the different specialists came in, I was taking notes and I was like, oh, but he has such and such. And one of the physicians said, can we take you to each patient room? I'm like, I can only be responsible for my people. But my point is, post-stroke, as he was navigating the healthcare system, I am essentially his historian. I'm also the fact checker, because we'll be sitting in the exam room, and this literally happened recently. Blood pressure was high. And so the doctor said, well, are you taking your medication? And my father says, kind of like a no, yes. And I'm like, when was the last time you refilled that medication? Doctor looked in the computer, hadn't had a refill in a year. So no, you're not taking your medication, right? So then we started going through some other stuff. And I was like, I think he's also having some problems with his hearing, right? So I'm letting my father sit side by side with the physician, but I'm over in the sideline. And every time I need to jump into the conversation, I'm jumping in, because if I don't, he's not going to say anything. He's going to act like he's been taking that blood pressure pill, all year, when he hasn't. And so the part about knowing your history, I think, is so important for you to know what you have a family history of on both sides, so that when you're experiencing, and for those of you who are layperson, I'm gonna make it plain for the layperson, which is what the book does. Your body has 11 organ systems, right? And each of those organ systems have some different ways that your body can tell you that you're not good. But there are some other symptoms that are silent. And so you, as a person, as a lay person, you need to know what's in your family history. So when you go sit in front of the physician and you have a history of cancer, and then you happen to have a lump, in your breast, the doctor can respond, as opposed to it being a scavenger hunt during this 10-minute visit. And let me just tell you guys this. I'm passionate about physicians. They're thinking about you. They're thinking about the next patient. They're thinking about all the charts that they got to complete before they go home. And wait, they're thinking about their family, how they're missing all the different after school activities because they're leaving the office. Now they're logging into the system. They're trying to complete the charts. So their work-life balance is off. And this movement is your way to help you get better health care. My grandmother used to say, whatever the doctor said was right. Well, Grandma, sometimes it's okay to say, well, Dr. Hester, I've had this problem from XYZ, and I was taking this over-the-counter medication with this prescription, and, blah, 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 as opposed to just sitting there thinking a miracle is going to happen. Mm-hmm. And I remember working as a medical assistant where the physicians would say, all right, we're going to tackle your top, what 3 problems are the most pressing, and that's it. But then what about some other things like the mental part that you don't have an opportunity to explore, and they have some problems. Mm-hmm. So all you patients, my message, again, I'm no medical doctor. My doctorate is in healthcare administration. Mm-hmm. I know how to make sure we keep the doors open, but I wrote in my book, I want to make sure you guys can see it. Let's see. Know your history. That is so very, very, very important. And Dr. Ann talks about potential results of poor doctor-patient communication, excessive testing, multiple procedures, misdiagnoses. You just empowering yourself to have a clue what's going on with your body. Like, oh, my child had an ear infection. I think it was in the right ear. Maybe it was in the left ear. But by the time you get to the doctor, both ears are clear, so we don't know which ear it was in. I can't make this stuff up. And because I read medical records for a living, I read and hear all of these things that I could write a book similar but different about how we can do better. So, Dr. Ann, what would you say? So I talked about, around the dinner table, holidays coming up, having the conversation. What would you say to those patients who feel like it's not their place to be this involved because you went to school all these years? Why do they have to come to the table with information? You said it, but I want you to say it again, but say it a different way, maybe with an example that can help them understand why they need to be more empowered.
Do you own your body or do I own your body? So you made an excellent point. Doctors, there's so much going on. When the doctor is in with you, maybe the doctor is 100% focused on you, but maybe the doctor is thinking, if I don't get out soon, I'm going to miss my son's soccer match, and my son's going to be so upset. Or I have not eaten at all today because I've been seeing patients, my stomach's growling, my blood sugar's falling. Or I have all these patients who need to be seen, I need to get these records, I have all these things to do. Do you really want to trust your health to a human being who's at 100%? Do you want to trust your life and your health to a normal human being who is not functioning at 100%? We're all human. And so if you take the lead and you show the doctor, I am knowledgeable, I know what's going on, I know what's going on with my body, that doctor is going to feel you are a delight to see. When he sees you're on his schedule for the day, oh, great, Mrs. Jones is here. She knows what's going on. She'll get right to the point. She will help me help her get the right diagnosis and move on to the next patient versus, oh, Mrs. Brown is here again. She's going to go on and on. She doesn't know what she's talking about. I'm going to have to keep pulling this out of her. She's going to get upset because I have to interrupt her. You have to decide the persona that you want. You can stand up tall, not that you're ever going to know, all your doctor does, but you can go in with an attitude of being respectfully assertive and knowing what's going on. Or you can go in, well, I don't know what's going on. How long has it been going on? Oh, I never thought about it. But it makes it better worse. That lady who took 10 minutes to answer that question, the yes or no question, that's a perfect example. But just like you would not take your car to a car dealership for repair and then let him give you a $5,000 bill and you don't question it, think of your body far above you think of your car. You want to know what's going on. You want to be involved. You don't just give that mechanic your keys and say, burn up the bill, do whatever you want to do. You don't do that. And you need to take your life even more seriously, far more seriously than that. And so if you don't choose a partner, if you want to be a passive bystander in your health, expect a passive bystander's result. If you want to be strong, proactive, learn what's going on, be a partner with your doctor, expect a higher level. You have to make that decision. Nobody can make it for you.
Oh, I love it. I love it. So first of all, there's also, let me just say this. Did I say I love this book? I love this book. There are also worksheets, right? Where you can list your other doctors. Okay, so here's the other thing, folks. If you go to Dr. Smith on Monday and he sends you for a blood test, and then the following week you see a different specialist and they're going to send you for a blood test, It'll be very helpful for the second doctor to know what the first doctor ran, because if you had a blood test and it was a purple tube on this week and the next doctor wants to run that same test, maybe it's medically necessary, but if they had the information, they would know. So you need to be paying attention. When I'm admitted to the hospital, which I haven't been in a long time because I have been a good steward over my health and exercising and all of that. But when you're getting medication, ask what it's for
Absolutely.
and have your own list of all the medications that you're taking, including vitamins, because some of these things don't play well together. And then now you cause another problem that's caused another treatment plan to be introduced. It's this vicious cycle that
Absolutely.
you have to get on the journey. And then here's the other thing. There are some quizzes in the book. There's a chapter on technology in healthcare. And this is a really sensitive subject for me because during the pandemic, my mother had a telehealth visit. She told me I got a visit in a couple of hours and I'll let you know about it when I'm done. So I said, okay. So I called her. I'm like, what happened at the visit? Oh, I couldn't navigate the platform. So they told me I had to reschedule. And the next date was like weeks later. So I was like, Mom, this will never happen again. This was during the pandemic. So I told her, meet me in Zoom. Open up this platform. Let's see what browsers you need to do some things with. And I said, for this visit, I'm going to be in Zoom. You're going to share your screen. And the moment the doctor comes on, he can see you, you can see him. I'm going to exit out of Zoom to make sure that you're good. Technology is here to stay. So you need to make sure that you test it before the appointment. Can you see? Can you hear? Right? Then you got a strong internet connection. You can't be on the telehealth visit, driving in the car. You need to be present and ready to execute the visit with all of your tools in front of you. So knowing your health history, exercise, diet. I try to do it every day. I'm not always successful. At young 51, I measure my blood pressure every day. Now, it's 106/74, but I still need to know when it changes. And so coincidentally, I had a death in the family. And for that week, my pressure was higher. And I was like, wait a minute, am I doing something different? Then I realized my body was probably having an emotional response to the loss of my aunt. But I knew what my normal blood pressure is. And then I was able to understand, which I did not have to call my doctor because I knew what was going on and I continued to monitor it. So folks, you've got to get more engaged in your healthcare. Trust me, it will serve you so well that you'll find yourself advocating for yourself in situations where it's critical. And I'll just share one more personal story because I want to show you how powerful this is. I went out of the country. I mentioned having the asthma exacerbation, right? But I was also taking these malaria pills. And third ER visit, I was like, hey guys, I've had diarrhea for a month. And the first thing they said, diarrhea generally resolves itself, blah, 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 blah. I said, no, something is different. I had the asthma exacerbation. I was taking the malaria pills. I was started on my emergency stash of prednisone. I was coughing, so I was taking all this other over-the-counter stuff. And I said and this was a nurse practitioner, I said, something is wrong with my colon. Please, please, please do a CT scan. He said, I don't think it's going to show anything, but I'm going to go ahead and do it. My entire colon was inflamed. And that nurse practitioner came back and said, thank you for fighting for you. Thank you for fighting for you. But I knew something was wrong. My body was off. But I could have just went home and said, diarrhea resolves itself. but I fought for me.
That's awesome.
So Dr. Ann, what's the future hold for you? So you got this really cool book out, which I would like to see this book in some of the medical coding programs, only because when I am trying to teach someone who just had medical terminology about HPI and what happens during the exam and the medical decision making, it's a struggle. And so I love how it's simple, very simple. But what does the future hold for you?
Well, now I am doing speaking engagements. I am a health coach. I just started that because I want to have more direct impact with people. So I'm doing group health coaching. A lot of people don't realize that we are looking at a global gender health gap that literally costs women about 75 million years, 39 trillion minutes of life, quality life each year because of poor health and early death. That's according to a report from this year from the World Economic Forum and the McKinsey Health Institute. And so I'm doing coaching centered on women, but I'm certainly available to do health coaching with men. I have a syndicated column with The Price of Business. I have a platform called patientworld.net. And it is like, if anybody's familiar with Udemy, it's like an on-demand site for health and wellness courses. So I actually do a patient empowerment one-on-one masterclass on this platform, and people can go on, enroll in the course. And I have actors who are acting out, different parts of, I'm the doctor, this is the patient, and so forth. And so it's a very fun, interactive way just to reinforce things. I have an internationally known cardiologist who does a course on coronary disease, the major cause of death, just a lot of things, and I'm adding more things. And so online courses through patientworld.net, and I also just started one on Thinkific, the blueprint for vitality, and that particular focuses on women and coaching and speaking and writing, and I'm available to do workshops for churches and other organizations to empower their people. And so there's so much that needs to be done, and just being able to empower people means a lot. Right before I got on with you, I'm a podcast host, I forgot about that. I actually did an interview with this person I met 10 years ago through LinkedIn. He was writing something, and I responded, and he listened to what I said. And so years later, he was diagnosed with benign ethnic neutropenia. His white count was low, and he said, because of what you said, I went back and got all of my Army records for all these years, and I plotted them. So when I took it into the doctor who said, your white count is low, and oh no, the repeat one is less, looked at my test results and said, it's been going on so long, it's probably nothing major, ordered a few tests, but did not proceed to the bone marrow biopsy and so forth. So I literally, just did his interview earlier today about how a conversation I had with him 10 years ago had a significant impact on his health. And so that really made my day, being able to empower people, seeing the light bulb go off, knowing you don't have to be a doctor or a nurse. You can get out there and make a big difference. I did a workshop for a group of landscapers, and they basically have high school education. And I did the workshop and did the mock doctor-patient interviews. By the end of it, they hit the nail on the head. You would have thought that these people were PhDs. People just need the knowledge. They need the information. Give it to them in a way that they can absorb it, and then they can. So my goal is empowerment.
Oh, I love it. I love it. I love it. There's so much work to do
A lot.
in this area, and you're focusing on women. And unfortunately, men are a little tougher nut to crack.
But we're still working on it.
We're still working on it. And you know what? This is what I've resolved. I can only help my little tribe, right? My father, my uncle, my husband. Again, folks, talking about knowing your history, being empowered. My husband was in the bed sleeping, and I was like, again, I'm no physician. I'm like, he got sleep apnea. Got a sleep study, and guess what he had? Sleep
Yeah,
apnea,
yeah.
because I was paying attention. He always teases me about, you pay too much attention to me. But I am in tune with his body because I know, he's a little slower to do the things unless I schedule them, which I do. But being empowered and being a part of your own health journey will help you live longer. So I'm definitely so excited about this movement that you're on, because we talk about Breast Cancer Awareness Month, right?
Mhm.
Every day is Breast Cancer Awareness Month, right? Not just October. I personally get my mammograms in November to let everybody else get theirs done in October, because I want them to have those slots, because I'm clear on the importance of prevention.
Can we talk about that for a moment? So something I forgot is I'm launching this PTR Reset initiative, Prevent, Treat, and Reverse. I'm getting a trademark on that because people don't realize that they can treat, prevent, and reverse a lot of diseases. And so I have a Facebook group, PTR Reset. I have, I am launching a YouTube channel for that. But about breast cancer, a lot of people have no idea how much impact they can have. Alcohol increases your risk of breast cancer. Exercise decreases your risk of breast cancer. They even found out that cigarette smoke can impact your risk of breast cancer. They did a study, women with breast cancer, they divided them. This group of women had a regular diet. The other group of women, they followed like a plant-based whole food diet, and they lived longer. Had nothing to do with the chemotherapy or the surgery. It's just choices that they made once they learned these things can impact my life. They literally live longer just by changing the diet. And so the PTR Reset, Prevent, Treat, and Reverse, that is another part of where I'm going. I know there's a lot going on, but there's so much to do.
I love it. I love all of it, because something just hit me. We got all these videos that you watch right before you about to have the surgery.
What
We
about
got to
preventing
have
the
the
surgery?
yes, right before you go watch the surgery, and this is what you can expect. But we need to be front loaded with the information. Like, for example, as an asthmatic, I know my triggers, right? I know my triggers. And when I'm triggered, I immediately take out my little kit, which includes a pulse ox, a peak flow meter, right? I am on it, because I decided I wanted to live. If Granddad can get to 103, so can I. Because I have to be in the background cheering Dr. Ann on and promoting this message, because this right here is the beginning. It's a whole movement. It's a whole movement.
Thank you so much.
So do you have any final parting words that you want to share with our listening, viewing audience? Hey, folks, it's even a chapter on insurance. Some of you don't know about your health insurance to save your life, and you want to blame it on the doctor because something is covered, not covered. It's not covered because you didn't read your policy. You don't understand your plan.
That's often the case. There's just so much. But what I would say is you have one body. And just like you probably have a 401k, a retirement, and you start plotting things out. If you're in business, you developed a business plan. You need to prioritize your life, prioritize your health. You can have the best business in the world. You can have $1 million in your 401k. And guess what? If you have a catastrophic illness and you can't enjoy any of it, what have you accomplished? And so prioritize what matters. If you don't have your health, what good is everything else that you're focused on? And so empower yourself, learn all that you can learn. Realize that America is looking at an unprecedented shortage of physicians. Physicians are not going to have a lot of time face to face. You may be waiting months and months for an appointment. When you go in, be equipped to hit the bullet points, give you 1 minute elevator speed so the doctor can order 1 or 2 tests, confirm what's going on, order the right prescription, and get you on your way. So prioritize is what I would say. That needs to be the key.
I love it. I love it. Well, listen, folks, get your copy, bring it to your reading groups. If you are a person who goes to church, you need to have this at your health fair. You need to have the conversations now. I don't know about you, but as I age, I'm going to more and more funerals, and I personally want me and my circle to live and be empowered. So, Dr. Ann, thank you so much for joining me today. I look forward to watching you grow with this movement. I'm definitely going to be advocating for this movement behind the scenes for you. Because there's so much work to be done. And I personally have been impacted by physicians, my primary care physicians, leaving medicine. And so we have to be equipped with our own information so that we can get the care that we deserve.
I really appreciate it, and I'm so glad that you get it. I mean, so many people like, oh, the doctor tell me what to do. Like, oh, the doctor's focused on something else. The doctor's got to get home. You need to step up. And so I really appreciate the opportunity to discuss this movement, to discuss the book, and it's really been a blessing to be on the show.
Thank you. Well, listen, everyone, this has been another amazing episode, 52 authors, 52 weeks.